I'm getting people that are looking to be the best that they can be and still look natural. And I think all across the country we're sort of finding that with breast augmentation, the numbers are still high, people are still getting breast augmentation, but with smaller implants. The general rule that I like to follow is if the end result, if 50% of the breast is natural and 50% of it is an implant, you're still going to look okay. The footprint of the breast, or the base width as we call it, it starts medially at the sternum and ends right before your armpit. And that is the footprint of your breast. You don't want the implant to be wider than that, because then it's going to make you look like you have breasts coming out of your armpit, and that's never cute. So that is really the first measurement that we start with. Looking at how saggy the breast is will determine whether you need a full lift or maybe use a higher profile implant, which means when you put it on a table, it stands higher than, for example, some other implants which would mimic a pancake versus the Madonna, cone breast kind of look. Most of those patients come talking about how they feel limited in some way. They're limited in the way that they can move. They're limited in how much exercise they can do. They're limited how much walking they can do in a day. Limited in what they can wear. Pain in their necks, their backs. So that's a very different conversation, and it's more not just aesthetic, it's functional as well. And those tend to be all across the board the happiest patients plastic surgeons have.